Okay, let's go on to talk about autoimmune diseases. So, as I've mentioned before, an autoimmune disease is where the body's immune system mistakenly attacks its own tissues, right? And it just depends on which tissues are involved in the attack uh, that will call it a different disease. Okay? So, what are some triggers of autoimmune diseases? We don't really know uh, the absolute triggers when someone develops rheumatoid arthritis or lupus or Crohn's disease or ulcerative colitis. We don't really know, but we think sometimes it may have been a viral infection. And that's a very good example of um, a condition called Guillain-Barré syndrome, where you get an autoimmune attack on your peripheral nerves and you become extremely weak and you can go into respiratory arrest. And we think it's triggered by a virus because often patients come with this disease and they give a history of having had a viral infection 2 to 3 weeks prior to the disease. Okay, so viruses, sometimes chemicals that get into the bloodstream might be a factor. We don't really know. We know that inheritance plays a role in many of them. Okay, so for example, rheumatoid arthritis can be passed through families. Eczema, which is a type of an autoimmune, can go through families. So many autoimmune diseases are partly genetic. And what occurs is what we call molecular mimicry, meaning the immune system confuses self-antigens as foreign antigens and then decides to attack the self-antigens in the cells, right? So you get tremendous amounts of inflammation and formation of B cells and T cells against its own antigen. Okay, most of the time, the immune system is very capable of distinguishing between itself and non-self. Otherwise, most of us would have autoimmune conditions. So when we think of autoimmune disorders, we can think of almost any organ that it can happen to. So the thyroid gland can be affected by autoimmune. Um, the muscles can have autoimmune. The joints can have autoimmune diseases. And we'll talk about these as we go along. And you've heard some of them already. You know, we mentioned rheumatoid arthritis, lupus, uh, there's psoriasis, Crohn's disease, ulcerative colitis, many others have the same underlying pathophysiology. And how do we treat autoimmune diseases? Well, we suppress the overacting immune system, right? So we use immunosuppressants to purposely reduce our own immune system and stop the autoimmune attack on ourselves. And we use corticosteroids because they're very powerful immune suppressants as well. Okay, so it's often a combination of corticosteroids, which typically we take orally, or if it's really bad, intravenously, plus immunosuppressant medications. Okay, autoimmune diseases. Let's keep on with this. So it's the adaptive immune system that's attacking itself. So every cell in your body has these self-antigens called the HLA system, and it's the B cells that produce antibodies against itself, and the T cells that see itself as foreign and attack its own cells, right? And depending on which organs are attacked will determine which autoimmune disease you have. So for example, if you have autoimmune attack on the joints of your body, you may have rheumatoid arthritis. If you have an autoimmune attack on your kidneys, you might have what's called lupus nephritis or systemic lupus. But typically in any of these diseases, you have many tissues attacked at the same time. So I don't want you to think that in rheumatoid arthritis it's just the joints, or in lupus that it's just the kidneys. That's not the case. There's often many organs involved in any one of those particular diseases. Okay? Type 1 diabetes is a type of autoimmune disease, right? So it's antibodies and T cell destruction of the pancreatic beta cells that result in complete loss of insulin. And these patients can become extremely ill because they have no circulating insulin in their bloodstream. And that leads to a whole host of metabolic disturbances in the blood that we'll talk about another time. Okay? Okay, so let's go around the body here on this slide and look at some autoimmune diseases. This is definitely not a complete list of autoimmune diseases. These are just examples. So when we look at the thyroid gland, if you produce autoantibodies that destroy the thyroid gland, you can develop a condition called Hashimoto's thyroiditis. And you will end up with hypothyroidism because the thyroid gland will stop functioning. Okay, so the antibodies will actually go and destroy the cells of the thyroid gland. Systemic lupus erythematosus, or we can just call it lupus, is an autoimmune attack on multiple parts of your body. It'll attack the kidneys. It can attack certain linings of your heart. It can attack the lining of your lungs. It can involve many, many organ systems in your body. Rheumatoid arthritis, antibodies to many parts of the body, and in particular to the joints of your body, where you end up with swollen, red, stiff joints. Okay. Multiple sclerosis is an autoimmune attack on nerves in the central nervous system. So we spoke about one called Guillain-Barré syndrome. That's an autoimmune attack on the peripheral nerves in your body. Multiple sclerosis is an attack on the central nervous system. Asthma, we've spoken about, another autoimmune system where you can develop antibodies to cause bronchoconstriction and increased mucus production within the bronchial tubes. Celiac disease is a gluten sensitivity, and it's a autoimmune attack on the small intestinal cells when in contact with foods that have gluten in them, right? So your small intestine has little outpouchings to help with absorption of foods called villi, and in the presence of gluten in food, there's autoantibodies that severely damage the villi of the small intestine, leading to malabsorption. Okay, so you're unable to absorb nutrients, and that often leads to weight loss, diarrhea, intolerance of foods due to the fact that the small intestinal wall is damaged. Okay, so the next one, eczema or psoriasis. So those are skin conditions where the immune system is triggered that lead to dry, scaly skin in the example of eczema, and thick plaques on your skin in the example of psoriasis. Okay, so all of these are considered different forms of autoimmune diseases. Okay, so let's just do this question together. Patients who suffer from autoimmune disease have hypoactive immune systems. That's false. They have hyperactive immune systems, right? They're producing autoantibodies in high levels that are directly attacking tissues of the body. Okay, so when you're thinking of autoimmune diseases and you see that term, always think of the treatment as an ongoing treatment to suppress the immune system with a variety of different types of drugs that you'll learn in pharmacology, plus anti-inflammatory drugs such as corticosteroids that also suppress the immune system and reduce the autoimmune attack. Okay, so you'll hear this term a lot, autoimmune, and the treatments invariably are going to be suppression of the immune system and the use of corticosteroids in differing combinations.